Hi everyone, this presentation covers Chapter 19 on population sampling in the third edition of Jacobsen's textbook, Introduction to Health Research Methods, a Practical Guide. In this chapter, you will learn that primary studies require an accessible and appropriate source of study participants. Here is an outline of the chapter. Section 19.1 covers types of research populations. Section 19.2 covers target and source populations. Section 19.3 covers sample populations. Section 19.4 covers study participants. Section 19.5 covers populations for cross-sectional studies, and the following sections will cover the other designs. So Section 19.6 covers populations for case control studies. Section 19.7 covers populations for cohort studies. Section 19.8 covers populations for experimental studies. And Section 19.9 covers sampling for qualitative studies. Section 19.10 covers vulnerable populations. And finally, Section 19.11 covers community involvement. So Section 19.1 goes over the types of research populations. And so anytime you conduct a research study, you find some sort of sample from a larger population. So starting off with the broadest of populations here, we have the target population. Our target population is the broad population to which the results of the study should be applicable. Within that population, we have a source population, and this is considered our sampling frame. This is a well-defined subset of individuals from a target population from which the potential study participants are sampled. Then within that sampling frame, we have a sample population, and these are the individuals from the source population who are invited to participate in the research project. You would hope that you have a large number of individuals from that sample population who participate, but typically not all of them do. So within that sample population, you have a study population. These are the eligible members of the sample population who consent to participate in the study and complete required study activities. So figure 19.1 goes over this. We have the broad set here of our target population. This is the largest population. Then within that, we have our source population. Then from that source population, there is a sample population that is eligible to participate and asked to participate. And then we have the study population, and those are the participants that actually participate. Section 19.2 covers target and source populations. A well-defined study question identifies a target population to which the results of the study should apply. So unless the study goal is extremely narrow in scope, it is usually not possible to invite all of the members of a target population to participate in the study. Instead, a more specific source population is identified, and then the sampling frame consists of some sort of list of population members that can be selected. Now, anytime you have a sample population, there are potential biases that may occur. Sampling bias is when individuals are sampled for a study, but they are not systematically representative of the source population as a whole. So they are selected, but they don't represent the larger population. Non-random sampling bias is when individuals in the source population do not have an equal chance of being selected for the sample population. And there are different types of sampling that you can use to sort of try and minimize those types of biases. So the most promising form of sampling, the best sampling method, is probability-based sampling. And these methods are used to ensure that all members of a source population have an equal likelihood of being invited to participate in a research study. There are four main types of probability sampling: simple random sampling, systematic sampling, stratified sampling, and cluster sampling. Non-probability-based sampling can also be used, and this is often used when you're conducting a study and you need some sort of easy access to participants. So this could be just asking people at work, asking people at the organization, or reaching out to communities directly. Now, populations are often systematically different from the target and source population when you use convenient sampling. So it may be easy to find people to participate, but they may not be representative of the target population as a whole. So they should be used with caution. So figure 19.2 goes over these different types of probability sampling. So starting off here on the left, this is simple random sampling. Each person has an equal chance of being selected in the population. Next, we have systematic sampling. And here, after a random start point, then every nth person is selected. So it could be that you select one person, and then after that, every two people in a list of people are selected. Then we have stratified sampling, and this is a simple random sample selected over each of several strata. So you could randomly select a number of males and randomly select a number of females. And then finally, you have cluster sampling, and this is where an area is divided into geographic clusters, and some clusters are selected for inclusion. So an example for this I'd like to include is if you did a study where you used elementary schools as your population. You cannot have first graders in one class be part of a study versus first graders in another class who have a different teacher. They're going to share information. So you would randomize your schools. You may sample the different schools to be in the study, and you would select one school versus another. The goal of sampling really is to have that sample population that represents the source population regardless of the methods used. So there isn't one perfect method of sampling, it really depends on the study. But some errors can occur by chance and cannot be resolved by randomization. So there are potential biases that can be mitigated with careful planning, rigorous methods, and sufficiently large sample sizes. Sample bias can be avoided by selecting more appropriate source populations and applying the inclusion criteria consistently. So a couple of biases to consider with your samples. First is Bergson's bias. And so this is when participants are recruited from hospitals and therefore they're more likely than the general population to have comorbid conditions. So if your sample includes all participants who are hospitalized, then the results are going to be different than if you had people who were not hospitalized. Now, healthy worker bias is the opposite of that. So participants who are recruited from occupational populations are healthy enough to go to work. So they may be systematically different than the general population who is not healthy enough to go to work. Another thing to consider is exclusion bias. This is when different eligibility criteria are applied to cases and controls. And this may cause controls with, say, health conditions that are related to exposure to be excluded, but the cases who may have comorbidities are not excluded. And so you want to make sure that any sort of bias is balanced between the two groups. Section 19.4 goes over study populations. A concept that Jacobsen covers here is the population rate. This is the percentage of members of a sample population included in the study population. So ideally, we want all sampled individuals to continue to participate. We want 100% participation rate. However, this is extremely rare. But high participation rate prevents selection bias in studies, so it's important to do whatever you can to keep people to stay in your study. And low participation rate results in non-response bias. Now, the following section goes over populations for the different types of study designs. Section 19.5 covers populations for cross-sectional studies. Study populations for a cross-sectional study should adequately represent the target population. A population-based study uses a random sampling method to generate a sample population that is representative of the well-defined larger population. So many population-based studies use probability sampling methods and complex sample designs to generate sample populations and then confirm the study populations are reasonably representative of the source population with which they are drawn. Sometimes they may oversample people with certain characteristics in order to be more representative of that population. So convenience samples are not really suitable for most cross-sectional studies that are population-based. Now, that does not mean that a convenience sample is not suitable for a small-scale cross-sectional study, say for your group project. But for a larger population base meant to represent, say, the United States, it's better to have a probability-based sample. And so figure 19.3 goes over a population example for a cross-sectional study. It goes over some different characteristics of the study listed here. So I'll just go over the target population, source population, and sample population, and then you can go over the other key characteristics on your own. So the target population here is high school students in North County. The source population is all high school students in North County, and then our sample population is all students in 20% of homerooms in all high schools in North County. Then section 19.6 covers populations for case control studies. The first step for a case control study is to find an appropriate and available source of cases to identify the participants. Then once the source of cases is identified, then a group of controls can be selected. All cases and controls in a case control study must meet the same eligibility criteria. So this is the inclusion and exclusion criteria, except for the criteria related to the disease status. So figure 19.4 goes over population example for case control study. Here, our target population is the American women ages 70 to 79 years. A source population for that includes all women ages 70 to 79 years admitted to St. Luke's Hospital System in Center City with an incident hip fracture in the last 12 months and their friends. So those with a hip fracture are the cases and their friends are the controls. So the sample population includes all women ages 70 to 79 years admitted to St. Luke's Hospital System in Center City with an incident hip fracture in the past 12 months and 3 friends per case. So oftentimes in case controlled studies, you have a larger number of controls than you do per case. Then section 19.7 covers populations for cohort studies. The sampling methods used for a cohort study must align with a particular method applied. So here we have the differences for longitudinal cohort studies and prospective cohort studies. For a longitudinal cohort study, the process of identifying representative source and sample populations is similar to what is done for a cross-sectional study. For prospective cohort studies, identifying exposed and unexposed participants is similar to what you would do for cases and controls in a case control study. So figure 19.5 covers the population example for a cohort study. Here, our target population is all children with cystic fibrosis in Canada. The source population includes all children ages 2 to 12 years who were patients of the cystic fibrosis clinics in 6 participating hospitals in the past 12 months. Then our sample population is 25% of the patients in the source list who are randomly sampled and invited to participate in the study. Section 19.8 covers populations for experimental studies. Sampling methods for experimental studies focus on the validity of the study and the safety of the participants. So here we want to maximize safety and minimize harm. The risk of harm can be reduced by selecting an appropriate source population and including a very strict inclusion and exclusion criteria. Figure 19.6 goes over a population example for an experimental study. The target population is first-year students attending primary residential colleges. The source population comprises of all students enrolled in mandatory first-year seminar courses at East State College. And the sample population is a randomly selected sample of students from the list of enrolled first-year students. Now, the study designs that I just covered were all quantitative designs. However, section 19.9 covers populations for qualitative studies. Qualitative data collection is not the same type of process. It's not as structured as quantitative studies. Researchers typically have some sort of intense contact with a selected group of informants that help decide on the sampling. And these may be key informants who are individuals selected to participate in a study because they have expertise related to the study question. A sampling method that may be used is purposive sampling, which is a non-probability sampling method that recruits participants based on special insights that they can provide. In qualitative studies, typically we don't come out with a set number of people that we have to include. What we're really looking for through interviews and focus groups is data saturation. This is a threshold where no new information about a particular theory or the topic that you're asking questions about in the data collection process comes up. So people start to give the same answers from that population that you are collecting data from. And so there's no need to continue because people are basically just saying the same thing. And so it's usually about 15 to 20 interviews, but sometimes it may be smaller and sometimes may be larger. Section 1910 covers vulnerable populations. So as mentioned in the chapter on the IRB, special precautions always need to be made for vulnerable populations. These include populations whose members might have limited availability to make an autonomous decision about volunteering to participate in a study. So this could be young children, individuals with serious health issues, prisoners, people who are homeless, or some other socially marginalized population. And anyone else who may have a limited ability to make an important decision about volunteering to participate in a research study. So say someone who is cognitively impaired. Vulnerable populations should not be selected as a source population for studies that do not require their participation. However, it's important to make sure that you're not excluding them just because you don't want them to be in your population. Because if you exclude them from research, there's no way of studying their health issues. And so you want to make sure that you just account for if there's vulnerable populations in your research study, or depending on the design, then you may decide whether or not to keep them in there. And so finally, section 1911 goes over community involvement. This is extremely important if you're doing studies within the community and doing community-based participatory research. So many studies benefit from or even require participation from local community groups. So these may be geographic, cultural, educational, religious, or other social communities and their leaders. Connections with community representatives should be established early on in the research process and maintained throughout the data collection and dissemination period. The process of including community members in the research process is community-based participatory research. And the approval of community leaders does not negate the requirement to obtain individual informed consent from participants and whose individual data is being collected. So you still have to have an informed consent from participants, even if a community leader says, yes, you can use my church or whatever type of organization you're involved in. Okay, so that is it on chapter 19. Thanks for listening.